Brain training for psoriasis and psoriatic arthritis. I'm Dr. Trish Leigh. In this video, I want to share some probably new ideas with you on how you can heal scalp psoriasis of the skin, and psoriatic arthritis. Now, I know what you might be thinking. Those are skin conditions. Why is a neuroscientist who focuses on brain training talking to me about a skin condition? Well, the reason is if you go online and you look at what the cause of psoriasis is, you will find the classic answer that etiology is unknown, that there is no reason, there is no source. And as a healthcare professional and a brain health coach, when we come across an issue that says that there is no cause, no known cause, it gives me pause, and I want to give other people pause to be able to think for yourself and say, everything has a cause. And the reason I care about this condition, and I'm even making this video, is that I have been on the very long road of recovery from toxic mold poisoning, and psoriasis and psoriatic arthritis is something that popped up for me during that toxic mold time in my life. And I went to so many doctors. I went to one dermatologist, which was slightly enraging, and I shouldn't be enraged on YouTube, but I went to a dermatologist who basically told me, I cannot help you. And I paid $200. And this has happened to me in so many other aspects where I go to the doctor, I'm paying cash out of pocket because that's how I roll. And $200 later, they just tell me, I can't help you. And I said to that dermatologist, can you send me somewhere else? Can you provide any insight? Can you give me one little nugget to chew on? Since I drove 45 minutes, I waited 35. I've been waiting 6 months for this appointment because I was referred to you. Nothing. $200. Goodbye. Nice to meet you. I've got nothing for you. So I want to share some insight with you here in this video so you have greater understanding of what is at the core of psoriasis and psoriatic arthritis. So, of course, there is an etiology. And if you dig a little deeper for the cause, it will say that it is a product of autoimmune disorder. Autoimmune disorder means basically it's attack on yourself. Auto meaning self, immune meaning immune compromised. So in the case of psoriatic arthritis, there's so much inflammation that your joints blow up and you will have pain and discomfort, and also your joints don't slide like they used to, and they can be disfigured. It can be very painful and very disruptive to your life. In the case of scalp psoriasis or psoriasis of the skin, you get plaques. There's plaques that grow on your skin, and the source of that is that your body thinks it's under attack, so it triples, quadruples, it accelerates the rate of making new skin cells so much that you get thick patches of skin. And the reason it does that is because your brain is stuck in fight or flight. It's stuck in sympathetic dominance for some reason. That reason is a stressor. So it's either a physical stressor or an emotional stressor. So in my case, with toxic mold poisoning, I was constantly being bombarded by toxins. If you don't know, mold makes metabolites called mycotoxins. They are carcinogenic. They are cancer causing. They gave me a lot more problems than just psoriasis. But one of the problems they gave me was my body thinks it's under attack, and basically it's laying down new skin and it's creating inflammation, and I'm blowing up to be able to protect me from the physical stressor that was coming at me at all times in my air. Now, of course, I'm the mom of 5 kids, and I've been married for 22 years. I have plenty of emotional stressors as well. If you have ever raised one kid, never mind 5, and 4 of them are now young adults, It's just constant stress that, yes, I deal with very, very well, but it's there. The emotional stressors are there and the physical stressors were there until I remediated my home significantly. So I was being bombarded by stress and my body was giving me symptoms to let me know, red alert, girlfriend, you are under attack. So I thought I was under attack because I was, and then I got stuck in that mode. So now the attack is over, but I need to turn the warning bells off. So what does brain training have to do with any of this? Your brain is stuck in sympathetic dominance. It keeps your nervous system on red alert, fight or flight. The solution is to enhance parasympathetic engagement. Parasympathetic is rest and digest. So of course, behaviorally, when people work with me in my neurofeedback coaching program, I'm giving them lots of parasympathetic behavioral strategies to engage in so that the system can come down. But I know it's not as easy as that. When the brain gets stuck in this mode, it can be very difficult for the brain to come out of this mode at an unconscious level. It's not that you're doing anything. It's stuck in fight or flight. It's stuck in survival mode. So what's the solution? The solution that I offer and that I use myself is to provide you a brain map that shows you exactly what your brain is doing, how your brain is performing, how much and how many areas are stuck in autonomic nervous system dysfunction that leads to and perpetuates autoimmune disorders like psoriasis. I'm able to show you your brain is stuck in this mode. Now, after we do the QEEG brain map, the best part is not only can I show you what is causing and perpetuating your psoriasis, I have state-of-the-art technology that can unstick your brain from fight or flight. It starts shifting your brain out of that mode into the mode of calm focus so that your system can bring the warning bells down and begin to heal itself. We forget our systems are self-healing when the conditions are right. I want to make the conditions right for you so that your brain begins to heal itself. I liken neurofeedback to stitches. So first of all, we have to move your brain out of its stuck mode and move it closer to the optimal mode. That's exactly what stitches do. If you have a physical wound, we take your wound out of the spread apart mode, we bring it much closer together, and we stitch it together. The way I talk about that is unwire, rewire, and hardwire your brain in the right direction. Now, another motivator for making this video is that I keep seeing, not that I watch that much TV, but when I watch TV, for example, the Super Bowl, there were so many pharmaceutical ads for psoriasis. And as a person who had psoriasis and fully understands it, that was upsetting to me because it's just a Band-Aid. When you take a pharmaceutical, yes, it's okay if you can't go out and you're in pain and you have discomfort and you have to scrape plaques off your head every single day. Yes, I get it. Pharmaceuticals are a Band-Aid, but you will have to use that Band-Aid for the rest of your life if you don't get the stitches. So I would love to provide a QEEG brain map so you can see how big that healing gap is, that wound, and how many stitches are necessary to be able to help you heal. So if you're inspired and you're looking for help with psoriasis or psoriatic arthritis, I want you to know your brain's involved and I can help. So please go over to drtrishleigh.com, check out QEEG Brain Map, first step, and to work with me. And I would love to meet you. We'll spend an hour on Zoom and I'll be able to connect your history, how you're living your life currently in terms of your lifestyle, and how your brain is performing to be able to set you on a new neural pathway and on a new pathway in your life towards creating the life that you want, leaving psoriasis behind. Okay, I hope to meet you soon. And until next time, control your brain or it'll control you.